Hi, my name is Dr. Richard Lau. I'm a family practice doctor, and so I spend a lot of my day dealing with things like tobacco. Now, everybody knows that we need to stop smoking. Everybody knows that tobacco is bad for a whole lot of different areas. But I'll bet you didn't realize the effect that it has on your sexual health and on your gynecologic health. First off, for men, smoking is a major cause of erectile dysfunction. There's a reason that people smoke after sex, not before. For women, though, this is really an important area too. You see, in the vagina you have folds and wrinkles, and these folds are called rugae, and they are very important for the health and structure of the vaginal tissues. This is the one area where you really want to keep your wrinkles. Now, when you smoke, you decrease collagen fibers, the same process that goes on in the face and gives people the smoker's wrinkles goes on in the vagina and causes loss of structure. This can lead to the internal pelvic organs starting to slide down, which is called pelvic prolapse. This can also lead to problems with incontinence. So if you want to have a healthy sex life, or you at least want to stay continent, you gotta stop smoking. So now that you know that you need to stop smoking, the question is, how do you do it? This is really difficult. Nicotine is one of the most addictive substances there is. Well, here's a few pointers that will help. Pointer number one, you've got to make a plan and set a date. And the date needs to be this year. Sometime in the future doesn't count. There's no time like the present. Pointer number two, throw out all tobacco products in the house. That includes the car, that includes at work. In a moment of weakness, if it's simply not there, well, that makes it harder to smoke. Pointer number three, tobacco is a habit. It's a nicotine addiction, but it's also a social and personal habit. So you need to replace that habit with other habits. Do something positive with your hands, with your mouth. For instance, if you need that oral fixation, chew some gum. If it's nicotine gum, so much the better. That gets your mouth busy doing something. If your hands need to be occupied, then take up something that occupies your hands. Knitting, one of these little flip spinners that the kids use. Some people learn little tricks to do with their pen. Anything to break that habit. One of the biggest habits is social time. For a lot of people, they smoke when they're on their break or they smoke when they go to a bar. That's not addiction, that's a habit. Pointer number four, enlist social support. What this means is that when you decide this is the date that I'm going to stop smoking, you need to let people know that. People around you, if they understand that you're serious, are usually willing to be supportive. Making sure that your spouse is not handing you cigarettes, making sure that someone isn't going to the store and buying them for you, making sure that the coworkers at work aren't constantly offering them to you on your breaks, so that they know that you're making this and can give you that kind of help. Pointer number five, take up other activities. For instance, if you're exercising regularly, you will very quickly start to realize that the smoking interferes with this. And you don't usually see regular exercisers who smoke. Practicing some meditation when you feel the need for nicotine can not only help with the anxiety and the addiction, but it's a good thing for you anyway. Pointer number six, there are a number of medications that can be very helpful for stopping smoking. You can talk with your primary care doctor about these different options, but some of the options include nicotine patches and nicotine gum. Sure, you're not breaking the addiction directly and immediately, but what you are doing is replacing some of those habits from the cigarette with something else to help break that addiction. And I want to leave you with one last thought. The average number of times that somebody tries to quit before they're ultimately successful, studies say that's around 7. Now, I'm not saying that to make you get disheartened. I'm saying that because you need to get back on the horse. If you fall off, do it again. You fall off, do it again. Most people do. But eventually, the odds are that if you keep with it, you will be successful at stopping smoking. I have sort of a dry sense of humor, and I always like to tell my patients that everybody stops smoking one way or another.